Now, in today's announcement, the Prime Minister's office makes reference to upholding the Canada Health Act and states that publicly funded healthcare must be protected and equitable access always determined by need and not by one's ability to pay. But does the proposal do enough to guarantee that? To discuss the matter, we're now joined by Pauline Worsfold. She's chair of the Canadian Health Coalition. Ms. Worsfold, thank you for joining us today.
And thank you for having me.
So as I said, a reference in this proposal regarding public health care, and your organization is very clear. It believes in public, not private health care. In fact, you held a demonstration today in Parliament Hill stating that fact. Hundreds of people came out. So as the premiers and the Prime Minister get together, when you look at the terms of this agreement, or at least proposal, does it do enough to protect public health care?
Well, I'm not entirely sure it goes far enough for us. We're very pleased because we've been asking for additional funding for the provinces and the territories to put towards public health care for a number of years now. So we're very pleased with the funding announcement, but we are nervous about the lack of accountability mechanisms that are referred to or not referred to in the agreement. We would like to see very strict accountability and transparency on behalf of the provinces and the territories about where every single penny of the federal funding is going to be spent, because we don't want any money going to line the profit pockets of the profiteers.
Well, the federal government is asking for data here. That they're looking for accountability through that data sharing. Will that not accomplish, at least in part, what you're looking for?
My quick look at the agreement today doesn't really talk about where the money will be spent. It more talks about data of numbers of nurses and physicians and other healthcare workers in the system, and to see where the gaps are, which is sorely needed. So we're glad that that piece is in there. But as far as the financial accounting, there should be, it's taxpayers' money that's being spent on healthcare, and we want every penny of it, again, spent in the public healthcare system.
Mm-hmm. Now, to that though, of course, there is a private element of healthcare right across this country, and just recently, Ontario has had to answer questions about its decision to essentially relieve some of the pressure in the backlog by turning to private healthcare providers. But to listen to the Ontario Premier, and this is a paraphrase of what he's saying, no matter where you get your healthcare in the province, Ontarians will be paying with their health card and not their credit card. Does that not go at least enough to guarantee a sense of universality for people?
Well, I think it's a slippery slope to involve private delivery, even if it is not for profit. And yes, you're right, we do have it across the country, private delivery, but it's a not-for-profit basis. It's a slippery slope. It's a step in the wrong direction. I think we need to invest more in public health care with public dollars, so people, again, don't have to pay with their credit card. They just show their health card and not their credit card. And it is based on need and not greed.
Mm-hmm. Now, of course, there are also these side deals that must be negotiated with each province. So in terms of the priorities that you're setting out to protect public health care, what do you want to see in those agreements?
Well, we have been advocating for over 2 decades now, the Canadian Health Coalition and others, on pharmacare. We need a national public drug plan for every single person that's living in Canada. And Dr. Hoskins produced a report for Prime Minister Trudeau, so we want to see that report implemented, because pharmacare, it not only saves money, but more importantly, it saves lives. So it's a win-win, and for the provinces, it's a win. So it's a triple win. So we can't understand why it hasn't been implemented to date, and we look forward to seeing something on it before the end of 2023, because time is running out. It's a pivotal moment in healthcare right now, and we need to do something, and we need to do something today, yesterday.
And of course, beyond the agreement, or at least the proposal today, that's something we're watching because it is a term of the NDP supply and confidence agreement with the government. So Pauline Worsfold, thank you very much for the time today. Really appreciate it.
Thank you very much. Thanks for having me.